Metoprolol, Prazosin, two completely different medicines, yet just a few letters at the end of their names can tell you exactly what family they belong to. Coincidence? Not even close. Look closely at the world of medications. Thousands of drug names exist. At first, they seem impossible to remember. Metoprolol, Atenolol, Bisoprolol, Prazosin, Terazosin, Doxazosin, different beginnings, different chemical structures, but something unusual appears. The endings start repeating. The pattern becomes clear. Metoprolol, Atenolol, and Bisoprolol all share the ending. Olol, Prazosin, Terazosin, and Doxazosin share zosin. The question appears, are these endings random? Or were they designed to tell us something important? This was not an accident. Drug names contain information. Hidden inside the letters are clues about the medicine's family, mechanism, and purpose. To understand this secret language, we need to go back to the beginning. Imagine a scientist discovering a new medicine. A powerful molecule is created. It has a unique chemical structure. It may have the ability to treat disease, but one important thing is missing. It needs a name. Before a medicine reaches patients, it receives an official generic name. This process follows the international non-proprietary name system, known as INN. The goal is simple: create names that are unique, consistent, and help healthcare professionals understand relationships between medicines. The molecule is analyzed. Scientists study its chemical structure and how it works in the body. The system recognizes its target, beta receptors. This tells us the medicine belongs to the beta blocker family. Now the hidden family marker is added, the suffix olol. This ending becomes a signal. When pharmacists and healthcare professionals see many drugs ending in olol, they immediately think beta blocker. Now the family appears: Metoprolol, Atenolol, Bisoprolol, Nebivolol, Propranolol, Carvedilol. They are not identical medicines. They have different properties and clinical uses, but they share a common identity. They belong to the beta blocker family. Notice something interesting. The beginnings are different. Meta, Ateno, Biso, Proprano. These parts help distinguish one medicine from another, but the ending connects them. The prefix tells us which individual drug is it. The suffix tells us which family does it belong to. But beta blockers are only one example. Another medicine family follows a different pattern. The molecule is analyzed again. This time, the target is alpha-1 receptors. The family marker appears, zosin. This suffix connects many alpha-1 blockers together. It becomes another clue hidden inside the drug name. Here we meet the alpha blocker family: Prazosin, Terazosin, Doxazosin. Different medicines, but connected by the same receptor target. They work mainly by blocking alpha-1 receptors, helping blood vessels relax. These medicines do not look the same. Their chemical structures are different, their names are different, but pharmacology is not only about appearance, it is about function. Different molecules can belong to the same family because they interact with the same biological target, like branches growing from the same tree. Different medicines can grow from one pharmacological family, and this discovery goes far beyond olol and zosin. Drug names contain many hidden patterns: pril, sartan, dipine, statin, cetrin, prazole, cane. Each suffix represents another chapter in the language of pharmacology. With this knowledge, drug names become easier to understand. Instead of memorizing thousands of unrelated words, we start recognizing patterns. The suffix becomes a decoder, a small clue that reveals a much larger story. Now let's test the system. Metoprolol. What family? Beta blocker. Doxazosin. What family? Alpha-1 blocker. Bisoprolol. Beta blocker. Terazosin, alpha blocker. The pattern becomes easier with practice. In real healthcare settings, this knowledge is valuable. A healthcare professional may see an unfamiliar medication, but the ending provides an immediate clue. A drug ending in olol suggests a beta blocker. A drug ending in zosin suggests an alpha-1 blocker. The name itself provides information. Pharmacology is not a random collection of thousands of names. It is an organized universe. Medicines are connected through mechanisms, receptors, and naming patterns. Once you understand the system, the memorization becomes easier. The greatest skill in pharmacology is not memorizing every single drug, it is learning how medicines are connected. When you understand the language of drug names, you unlock the system behind them, but this is only the beginning. Beyond olol and zosin, many more hidden families are waiting. Pril, sartan, dipine. Each suffix opens a new door into pharmacology. Because every medicine has a story and every name holds a clue. Welcome to Clear Pharma, where complex pharmacology becomes simple.